Hi, my name is Ian Bostock. I am a master's student at Indiana State University in the athletic training program, and this is my video reflection for the standardized patients July 26, 27, 2018. I'm going to start with my patient care, followed by my case as a patient, and then go as a secondary clinician to review each one. For my starting, I'll do my first clinical case as my own. During this encounter, I had a clavicle fracture of a patient that was down on field during an evaluation. I felt pretty good during this evaluation, getting the patient to kind of talk and assume. I kind of assumed something serious happening, especially with being on field. I know the other patients that we'd had seen before were all in a clinical setting, and then this was an on-field evaluation. So I felt like during that it was pretty simple experience. I felt pretty good. I knew essentially how I should handle the situation to the best of my knowledge. I also kind of figured out what needed to be done. For me, what went well, I feel like talking to the patient, figuring out what special tests could be done with the patient on field, not having any materials with me. That was something I felt like really well during what didn't go well for me. I felt like during the evaluation, I really wasn't prepared to get the patient up off the field. There were times where I felt like that I was a little lost trying to get them up, getting to a position. While I felt like vital signs could be monitored, I really didn't have any equipment to monitor a pen or pencil or any kind of monitoring thing, material, tools. So that was kind of tough. I didn't really know how to get the patient up without, kind of some guidance there. And then for me, it was just kind of hard to know where to go from there after the patient had gotten up. Clinically, I feel like this helps kind of in my future setting, especially going with football this semester. It'll be huge for me to look and see if I have a patient in this situation, what I could do. I would like to maybe have some equipment removal involved in there into a next setting so that I could see how to go about that in a clinical setting with some equipment as well. My next case I'll be reviewing is me as a patient. I was someone with ankle pain, just kind of had rolled my ankle, came down during some rec basketball. I felt like I pretty prepared for myself. I prepared myself pretty well for that patient. I portrayed it as best I could. I feel like there are some things it's just hard to portray. In different positions, there were times where I felt like I wasn't doing certain things right, and then from my paper, it was hard for me to see like what special tests I could be like, all right, yeah, that hurts, or this or that. I feel like if I had a clear knowledge of a special test provided during that, that would have been a little better for me. Went well. I feel like everyone on the clinical side of things, the team, really stepped in and helped each other. I felt like there were times where someone may have gotten confused on one thing as the lead, and then the two assistants really did help and provide some back knowledge, I guess you would say, some knowledge for the main lead. It went really well for them. Clinically, I feel like ankles are something we see quite often. I feel like if you get an ankle sprain, the hardest thing is figuring out if it's high or just a lateral ankle sprain. And you see a lot of lateral. But yeah, I feel like everyone there really did well. I feel like clinically, ankles are something we see quite often. So a lot of us have vast knowledge in how to handle ankles. A lot of us can go into this and see, okay, yeah, it's an ankle, but the shin splints part, the shin issue with that, I feel like could have hindered a fracture. So that's just something we could see and even use to our knowledge now, seeing that it may be a fracture. Maybe we need to look up the leg or down into the foot even to see if there may be other pains. I feel like those are both important for ankles as well. My third patient I'm going to review is the patient with hip pain. So that would have been me as an assistant clinician. That patient, it went well. I feel like there were a lot of things I went into that with us reviewing it just this last semester. I feel like the hip was something that was kind of fresh. It was less of me having to go back and really search into my knowledge of what I was supposed to be doing special test wise. I knew different tests there, certain ones that could be used to really try and get that and figure out what was going on. I felt pretty comfortable there. I felt like I knew what I should be doing, what I needed to be doing to help the main clinician. I feel pretty comfortable with the hip. I did a lot of hip last semester with patients, so during this encounter, I felt like I did a pretty good job getting some questions that may have been forgotten by a main clinician, even though it may have been answered a different way. I feel like going and asking again, just getting maybe a different answer, maybe more depth answer from the patient. I felt like there were times I knew a special test and I didn't know what it was called. So there were certain times throughout the patient care where I was like, okay, I know what I should be asking. I know the test I want to do, but I don't know the name of this test. So I feel like just reviewing special tests in general would be a huge help, just getting some names back. Not so much the test itself, but just the name of the test. Clinically, I feel like these patients you see are certain athletes, certain groups of athletes that have a motion that they do quite often, especially baseball guys. A lot of gymnasts, I feel like, may have this issue. So knowing the patient population and knowing which population is more susceptible to these injuries is something that you have to be aware of as an athletic trainer. So clinically, this case prepares us for those certain athletes. The last case we had was the everyday, I guess, average Joe with the overhead shoulder issues. This patient came in with what was some sort of issue with the shoulder. I feel like this patient may have been the hardest just because of the pain and it's a shoulder injury. For me, the shoulder injury is one that could have so many issues, but going into it, I didn't feel as comfortable. Honestly, it was one of those injuries where I didn't really know what to think. Shoulders, there's so much going on up there. There's so many muscles, muscle groups, joints, just everything there. So you have to really dig in deep and really think about the shoulder, especially when overhead. Someone that's been working overhead, it's a cry. But I felt okay afterwards and more into it, just kind of getting back into the groove of it. Pretty much the first case we saw, so it was just, you're like, not what's going on. What went well, I feel like we got the good questions out. We really dug in and kind of asked what we could, figured out different things about this patient. Really special test wise, we kind of ruled things out first, which I feel like you should be doing. You should be ruling out before you rule in. If something rules in throughout the way, great. The impingement stuff, there's once again special test. I feel like it's just a review for anyone, especially our class. Just, it seems like a review would always be nice. I feel like you always need to stay up on your special test. That's a big thing, just to keep reviewing and really knocking those out one by one. Clinically, this is something that you have to be ready for general population, I guess. You don't always see athletes in your job. If you work in a general population, if you work in a clinic setting where you're seeing a gen pop, you have to be prepared for these things. It's not always athletics where you can say, oh yeah, you were throwing, or you were hitting, or you were running, or you're doing this certain activity. It could be a guy that comes in after work and he's like, my shoulder's killing me, or my leg is killing me. And you have to be like, okay, well, what do you do? And he's like, well, this is what I do all day. You have to be prepared for those as well. So clinically, I think this case really justifies that sort of patient you see. Overall, I think these standardized patients are super helpful. It's a good getting back into the swing of thing kind of thing for all of us. So it was a great thing, and I would love to do them again.